So I was just as I was saying that I passed out from my dentistry or BDS in 2008, and during my internship, I realized that my interest in dentistry. So a lot of you who are not from the dentistry background would feel that dentist just is like is one singular specialty, but actually there are eight specialities from orthodontists, pediatric dentists to oral surgeons, and who do a wide variety of things, right? So in that, there's a small, I wouldn't say small, but a large subsection called the preventive medicine or public dentistry. So I was more keen on that. I did majority of my internship projects and camps on that, which basically talks about oral care and oral hygiene for the underserved population and the remote population, how to reach them and then improve awareness about different programs. So that was my main goal, and I pivoted, you can say, slightly after that to work in NGOs and with government health systems, like with Indian Dental Association, right, Try a Citizens Association for Child Rights, and then also on the National Health Program with different state governments. So that expanded my not only knowledge as a dentist or as a core healthcare provider, but also how these policies or schemes are implemented on ground. What are the bottlenecks? Who are the different stakeholders? How to implement programs in a frugal and where you don't have a lot of money to implement things. So that was I think a very important stepping stone or learning lesson for me. After which I got the opportunity to become a social entrepreneur, where I had my own enterprise, which was thankfully backed by UNICEF, and it still is backed by UNICEF, called CACR, or Citizens Association for Child Rights. I was the a co-founder and the projects director for about 6 years here. We worked a lot with government of Maharashtra on digital health, as well as on sanitation health, like the Swachh Bharat mission, the women empowerment program. We worked on menstrual hygiene and a lot of other programs. And from there, UNICEF recommended me for a consulting project with Gates Foundation. So we had a consortium of Gates, FICCI, Samhita, and other non-profits to do fundraising, or you can say grant matching for working in the social sector or public health sector. And I think that was the first time I was actually going out and pitching to large corporates to give money for or grant matching, that they would give their CSR funds or the philanthropy funds, and we would then create a program around their needs, and then we would match that with a grant from Gates Foundation. So that was the first time I was, you can say, doing a business, a quasi business development, or fundraising role, which led to my next assignment of impact consulting with CRISIL, or S&P Global Company, where I was doing impact assessment, evaluations, due diligence for large corporate clients on healthcare projects. So it could be like a due diligence of a project involving tuberculosis prevention, or doing a initial need assessment of a project involving anemia, right? So those were the kind of projects we were doing for clients. And after that, one of my clients, which was GE Healthcare, picked me up, where I got to experience the actual medical device technology, or you can say med tech industry, wherein social sector, or doing these kind of public private projects remained a part of my portfolio. But largely my portfolio then became medical devices, which are the large at GE Healthcare also had a portfolio of hospitals, or equipments, or medical devices. So there, I think a lot of hospitals, what we work with, from Apollo to Shalby, I think even Aster, and a lot of other Medanta, Fortis, right? A lot of you, I think, the people must be on the call. So really got to experience on how the equipment planning or the operation side. I had experienced it as a doctor, but now from the different lens, from the client lens, I got to experience it at GE. And then from GE, I worked with Roche Pharmaceuticals, basically in a patient advocacy and market access role, where I got to work with patient organizations who are working in oncology, hemophilia, and rare disorders, and they are doing fabulous work in the resource constraint and environment which they are working. So that was a very unique and enriching experience. And currently, I work in the digital digital health space with Geo Health Hub, which is a platform to manage your you can say, or your digital twin, your health twin, where you manage not only your healthcare needs, but of that of your family. So it's backed by Reliance Industries, and that's my current portfolio till date. So I have about 16 years of experience so far in different facets of healthcare, and hence I was going to also touch, if you want to pivot from one sector to another, how you can go about it, right? So that is, a snapshot of my journey so far.